Alright, so today we're going to be working on some breathing techniques and then also some airway techniques. Hi, Nat. My name is Shalissa. I'm going to be your student PT today. So first, we're just going to do a couple of breathing techniques, and then from there we're going to go and do some airway clearance techniques, and I'll just kind of run you through them as we're doing each one. Okay? Alright, so for the first one we're going to do is called diaphragmatic breathing. And so I'm going to have you lay on your back. And so the purpose of this one is we want to practice breathing more with your diaphragm instead of like your chest. So I'm just going to show you how you can check that for yourself. So I'll have you put one hand kind of with your upper chest, and then the second one can be kind of like right there, perfect. So when you breathe in, you want this hand to go expand, to go up, okay? And then when you're breathing out, you want it to decrease. And then you want to keep this at a very minimal, because you want to focus on breathing through here. Okay, so go ahead and try that. Do you feel this going up?
Yeah.
Okay. And then if for some reason you're practicing this and then you're like, I don't know if I'm doing it correctly, you can do like a little sniff, and then that'll kind of be like a cue for you. So it's like, and then you should feel this go up as well. Perfect. Okay, so go ahead and sit up for me. And so the purpose of that is just to minimize, like I said before, the use of the accessory muscles. We want to focus on mainly just the diaphragm. All right, so next thing that we're going to do is we're going to do pursed lip breathing. So for this, you're going to breathe in through your nose, and then you're going to breathe out through your lips. But when you're doing that, you want to kind of do this, like. So. Okay. And so this is just going to help if you have any like shortness of breath, just kind of get you back on track. Okay?
Okay.
All right, so go ahead and try that. All right, how's that feel? Okay. Okay, so the next technique that we're going to do is called like butterfly breathing. And so the purpose of this one is we want to increase like your lung and chest wall expansion. So what that means is like when you're breathing, we want more room for that air to go. So you're able to take in more, and you're able to also expel a lot more. Okay? All right, so for this one, I'm going to have your hands behind your head. And so what you're going to do is you're going to breathe in. And on the way down, we're going to come like this. So, same thing, in through your nose, out through your mouth.
Okay.
And using your hands just kind of helps you open up more of that chest area, because you can go like this, but it won't be the same thing as doing all that.
Okay.
All right, so now we're going to move on to airway clearance techniques. The first thing that we're going to do is huff coughing. So a patient would be indicated to do this if they had any pain or fatigue with regular coughing, or if they just have excess secretions in their chest wall. All right, Natalie, so for huff cupping, I'm going to have you breathe in through your mouth, and then on the exhale, I want you to stay hot, but without the teeth. It's kind of going to go like, kind of like that. Okay. All right. So whenever you're ready.
In through my mouth.
Go ahead and do one or two more times. One more time. And this is just going to help if you have like those secretions in your chest wall, if you're having any pain, just kind of facilitate that. Okay? All right, so now we're going to move on to manual percussion. So for this one, I'm going to have you lay on your side for me. All right, so the purpose of manual percussion is if a patient has like secretions stuck in the chest wall with either vibrations or percussions, it's supposed to loosen it up, and then they're able to excrete it a little bit better. So ideally, she'd be kind of tilted downwards, like 15 degrees, and then she's just going to be a quarter towards me. All right, so now go ahead and move your hands here, and I'm just going to kind of tilt you a little bit back, Now, if it's okay, I'm just gonna do some slight movements like that. Okay.
Okay.
Alright. Alright, and then this is for the lingua segment. And so essentially I'd be doing this for like 5 minutes, and then once she's done, I would have her cough. So I'm doing here 5 minutes, and then go ahead and cough for me. Good. And that would just be to finalize secreting everything that she had in her chest. So the last airway clearance technique that we're going to do is active cyclic breathing. So for this one, it causes thoracic expansion, which is going to help with expelling any secretions, and overall it just helps improve breathing control. Alright, Allie, so we're going to do this last technique. It's just going to help you better expel any like mucuses or anything that you have in your chest wall, and just kind of help you breathe a little bit better, okay? Alright, so what we're going to do is you're just going to breathe normal for 5 to 10 seconds, and then after that you're going to take deep breaths in and then out, and that would be 4 times. So you'll run that through twice, and then once we do that again on that last 4th like deep breath, you're just gonna do the same thing we did earlier, like the and then we'll be done after that, okay? Alright, so go ahead and just breathe normal 5 to 10 seconds. Alright, so now say that's 5 to 10 seconds. Let's do some deep breaths in and out. So in through your nose, out through your mouth. We'll do that 4 times. So we'll do some normal breathing. Alright, then go ahead, let's transition into those deep breaths again 4 times. And then remember on that 4th one, turn to your right and do that.